Thanks, everyone. I'm Jeremy Watson. I'm Vice President for our Northeast Region's healthcare team. I'm joined by a couple colleagues here. I'll let them introduce themselves.
Yeah, my name is Murad Shaush. I'm Director of Strategic Accounts for New York City.
Hi, my name is Pranay Tiwari. I'm the Director of Strategic Accounts and Persistent Systems.
And I think I'll start by saying is we're extremely excited to have the opportunity here to sponsor this event. This is exciting for us. We're very much looking forward to our partnership with the Mount Sinai Health System team, as well as being able to contribute to the School of Medicine here. So thank you to the team for having us. We really appreciate that, I think, as a starting point. As Ashish just mentioned, we're standing between you and dinner, so we'll try to push this along as best we can. So I guess first off, we're just going to give a quick introduction to Salesforce, the organization. We may not be as much of a household name within the group here, but we'll get you introduced very quickly. So we're an enterprise software company. We are in the cloud. That's where we started. That's where we've always been, and you can see the growth trajectory here as an organization, as well as some admirations that we've gained from Fortune magazine. I think what's exciting about this, and this really started 3 years ago, where our leadership and our CEO decided to make an investment in the healthcare business, and that was one where we were going to devote some of the R&D capital that we've been able to raise towards building products that were patient-centric, and really manage the whole continuum of care. So we're going to talk more about that. You're going to see the Health Cloud product over the course of this weekend, actually starting a little bit later tonight. So let's continue along here, Murad.
Yeah. So in the audience, how many people have ever heard of Salesforce before? Lots of you.
Oh, good.
You probably used it for student relations, if you're in college or in the School of Medicine. You may have used it in CRM. That's what we came out of. CRM being customer relationship management. So we're all about relationships. And if you think about healthcare, what's healthcare? It's all relationships. It's the patients and their doctor. It's the patients with everybody else who touches them. But it's also every clinician and every community-based organization and everybody else who thinks and services that patient has a relationship with everybody else. So it's very natural that CRM comes to healthcare, which is why Salesforce is in healthcare. So when Jeremy mentions, 3 years ago, we've been in healthcare, and as a matter of fact, we have probably tens of thousands of healthcare organizations using Salesforce. But they've been using it in the relationship sphere. But what we thought about is we need everybody to be connected. So guess what? We do it very well for companies selling stuff to customers. But we need to be good, and healthcare needs it the most, how to know and sense what's going on with your patient, what's going on with your fellow caregiver. And that's why we created Health Cloud. Health Cloud is a platform built on top of the Salesforce platform, which is all in the cloud. And so it's all about connecting health professionals, connecting care coordinators, connecting apps. We heard of the app from John a few minutes ago, and the wearable. Think about everything that touches that patient or is worn by the patient. Apparently there are things called insidables coming, and drugs that have little chips, right? All of that needs to be connected somehow and needs to provide us data, because the more we know about our patient, the more we can service them better and take care of them and maybe keep them out of the hospital, which is what we all want. Keep everybody healthy. So in order to do that, we need a platform. We need a solution that indeed allows us to service these patients, and allows us to put in the hands, as in a mobile device, on the screen, on a watch, on anything that we'd like, everything about that patient, everything about that caregiver. And so we built Health Cloud. Health Cloud is a series of not just screens, it's workflows, it's customizable objects that are all using very modern technology. Salesforce is at the forefront of innovation with tons of releases, three releases a year, major releases of software, all seamless, all instantaneous. And so what does Health Cloud allow you to do? It's a complete patient view. It's a total management, and I'll show you some screenshots here, and you'll get to touch it this weekend. We'll talk about that in a few minutes. And then it's all about engaging with the patient. We heard a few minutes ago from the esteemed panel that it's difficult to gain information about pain from the patient objectively, right? So when they come to us and they tell us how much pain, they can't recall, they note it down on their diary, but how wonderful would it be if we had devices that picked up that information and provided them to us? And until we get there, it's important to get that information instantaneously from that patient, potentially giving them a little scale, asking them to measure, alerting them. We all love our phones and our watches. As it triggers, they can input that information. It's very subjective, and it's directly from that patient, and we know exactly what that patient was feeling. So a couple of screenshots of Health Cloud. We see here what we call the patient network on the top right, and that's literally who's their caregiver. A lot of the time, the patient comes, and we have to look in the EMR, electronic medical record. We have to call somebody. We have to look at the piece of paper. We have to look at the appointment record. We have to look at a lot of places to understand who's taking care of this patient. Many times it's a kid, or maybe it's an elderly person, or maybe it's somebody with a chronic disease that they can't tell us. But so connect to their family. They're part of the network. So on the left-hand side here, and again, we'll give you more details after the dinner about Health Cloud, but on the left-hand side, that's the patient's ID card. We know everything. We're connected to the electronic medical record. It will not be connected this weekend, but you get the picture, and I'll give you some examples of who's using it as well. And then we all love to use our Facebook messaging. Well, this is secure, HIPAA-compliant messaging. We call it chatter, communicating between caregivers and the patient themselves. So what have people built with Salesforce? Up until Health Cloud and since Health Cloud, what have they built to service our needs in healthcare? They've built numerous applications, from community engagement, CBOs. We heard some folks talk about clinical trials, clinical trial efficacy, and understanding what's going on with the clinical trial. They built applications for that. Case management, care team collaboration, we talked about that a few minutes ago. Concierge medicine, we all want to take care of certain patients in a certain way so that they are taken care of because they are maybe very chronic type of patients. We want to make sure that they get to their right next point of care in the most efficient way possible, etc. So you see many, many different applications. A few additional screenshots of Health Cloud. This is what we call the timeline. So the box that you see right in the middle there is a patient timeline. That reflects, as I cycle it, and I can scale it many different ways. I can look at 1 week. I can look at 1 hour. I can look at past 3 years. Every engagement this patient has had with every piece of the health system. And I'll stop here to give you an example of how many large health systems, including this esteemed health system, is and will be using and continues to use Health Cloud for an important program. It's DSRIP. You might have heard of DSRIP in the state of New York. This is Medicaid reimbursement program. And the Mount Sinai Health System has already started using Health Cloud for the past year and a half or so, and they're going on a major expansion of this program in order to be able to take care of roughly 400,000 patients in this program, using Health Cloud to literally put in the palm of every caregiver and every community-based organization everything surrounding a patient. So I have the complete view at patient 360 of that particular patient using Health Cloud. So you understand why the timeline, why the patient ID card, why the caregiver network. All of that is really important. And then it's all about understanding who's touched this patient. And in this particular case, these are all patients, and I'm a caregiver, this is my screen, and I'm seeing all of my patients and where they're at. And the most urgent cases, obviously, are highlighted in red, they brought up, et cetera. So everything, and this is an application that is built on top of the Salesforce platform that delivers all of this right out of the box. And then there are a few reports and communication directly with the patient. It can extend a patient portal, a patient app directly off of this platform without having to go and code it separately for iOS or Android or whatever else. It's all built in. So I'll stop here and pass the mic to my colleague, Pranay Tiwari from Persistent Systems.
Thank you, Murad. First of all, we are really glad to be here as co-sponsors of the hackathon. Thanks a lot for inviting us. Persistent Systems is a technology company. We've been in the business of writing software, building products, right from the conception to actually releasing the product for the customers that we work with. Since about 25 years, 14 of the top 20 technology companies are our direct customers where we do R&D services, build products for them, including Salesforce.com. And as a company, we are about $400 million in annual revenue, publicly listed in India, have multiple accolades in terms of being a technically focused company that can drive our customers and partners from the world of actually building software to software-enabled businesses. And most of us are seeing that shift in the industry nowadays. In the Salesforce world, we've been a proud partner of Salesforce for about 6 years now. We've partnered with Salesforce on building the Health Cloud product right from the ground up. We've been involved with them, in working with the roadmap, working with various providers like Mount Sinai to build innovative applications on the Salesforce platform, as well as thinking about the next generation applications on the Health Cloud platform that's coming out. Persistent uniquely brings the depth of experience to address the payer, provider, patient, and physician group needs, as well as EMR integration due to our vast experience with working with multiple providers. This is just a snapshot of some of the episodes and some of the use cases that we have worked on across the provider ecosystem. And at Mount Sinai, we are deeply engaged with the Disrupt team. I don't know if you've heard of the term Disrupt. I'm sure some of you may have. We are working with them to transform the care delivery for the pay for performance model that's coming up. That's it. And I also wanted to quickly introduce my team here. Coming back to the hackathon, we have a support team for you who will be supporting the hackathon event from today until Sunday. And there are 3 guys sitting right there. If you could please raise your hands. If you have any issues with the platform, any technical issues, anything at all, we are here to help and support. Thank you.
One quick question. Who has had a chance to view the webinar 2 days ago that we presented? Okay, very good, few of you. So you got a little snapshot of what building applications on the Salesforce platform, building applications on Health Cloud. We will give you another quick snapshot after the dinner. There's a half hour. We're gonna take the covers off of Health Cloud a little bit to show you a little bit. But the idea is you're going to get, and we'll go through more detail, but you're going to get an environment that is your environment, and every team gets an environment of Health Cloud. It's in the cloud, so you'll get login credentials, and then we'll walk you through, and that's why the team here is really important for you guys to understand what you're getting. It's not beyond accessing it. What are the objects? How can you leverage some of the quick wins? And we'll give you some examples, etc., as the weekend starts. So again, very delighted to be here. Thank you so much for the opportunity to partner with the Mount Sinai Health System, Mount Sinai School of Medicine. And we're very delighted, such great brain power going hacking away on Health Cloud. So thank you guys, we really appreciate it.